Indications: pharyngitis, acute otitis media, Lyme disease, susceptible infections, sinusitis, otitis media, skin and skin structure infections, tonsillitis, respiratory tract infections, acute maxillary sinusitis, MDR, typhoid fever, urinary tract infections, acute bacterial exacerbation of chronic bronchitis, surgical prophylaxis, adults dose, pharyngitis or tonsillitis. 250 mg twice daily 5 to 10 days, acute bacterial maxillary sinusitis. 250 mg twice daily 10 days, acute bacterial exacerbation of chronic bronchitis. 250 to 500 mg twice daily 10 days, secondary bacterial infections of acute bronchitis. 250 to 500 mg twice daily 5 to 10 days, community acquired pneumonia. 250 to 500 mg twice daily 5 to 10 days, uncomplicated skin and skin structure infections. 250 to 500 mg twice daily 10 days, MDR, typhoid fever. 500 mg twice daily 10 to 14 days, uncomplicated urinary tract infection. 250 mg twice daily 7 to 10 days, uncomplicated gonorrhea. 1000 mg single dose Lyme disease. 500 mg twice daily 20 days, a child dose pediatric patients, 3 months to 12 years, pharyngitis or tonsillitis. 20 mg kg day in 2 divided doses 5 to 10 days, acute otitis media. 30 mg kg day in 2 divided doses 10 days, acute bacterial maxillary sinusitis. 30 mg kg day in 2 divided doses 10 days, community acquired pneumonia. 30 mg kg day in 2 divided doses 5 to 10 days, MDR, typhoid fever. 30 mg kg day in 2 divided doses 10 to 14 days, uncomplicated skin and skin structure infections. 30 mg kg day in 2 divided doses 10 days, uncomplicated urinary tract infection. 20 mg kg day in 2 divided doses 7 to 10 days, pregnancy category B. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women, or animal studies have shown an adverse effect. But adequate and well-controlled studies in pregnant women have failed to demonstrate a risk to the fetus in any trimester. Side effects: diarrhea, 4 to 11%, depends on duration. 1 to 10% decreased hemoglobin or hematocrit. 10% eosinophilia. 7% nausea or vomiting. 3 to 7% vaginitis. 5% transient rise in hepatic transaminases. 2 to 4% diaper rash. 3% increase in alkaline phosphatase. 2% thrombophlebitis. 2% increase in lactate dehydrogenase. 1% anemia, cholestasis, colitis, dyspnea, epidermal necrolysis, increase in blood urea nitrogen, BUN, and creatinine, jaundice, nephritis, prolonged prothrombin time, PT, international normalized ratio, INR, rash, Stevens-Johnson syndrome, stomach cramps, transient neutropenia and leukopenia, urticaria,